Let's say that one of your parents has begun to experience signs of dementia, and the number of things that they can do safely on their own is rapidly declining. Do you know where to get help for them, or do you have a plan? When dealing with a system as complex as long-term care, it's often difficult to get easy answers about where to start. We're going to attempt to answer two questions. What is long-term care, and what are some of the common barriers to care? Long-term care supports people with chronic or acute conditions, disabilities, or those who need help completing activities of daily living, such as bathing, toileting, preparing meals or medications, paying bills, transportation, and wound care. This type of care can be provided in a person's home or in a long-term care facility. Most people prefer to receive care in their own homes, which often means that care is provided by an unpaid family caregiver, such as one's child or spouse. While some can usually manage with help from family, friends, or neighbors, others may receive home and community-based services for help through a paid caregiver, home health aide, or bring their loved one to an adult daycare. Anytime long-term care is discussed, many people probably have an image of a facility like a nursing home come to mind. There are many types of long-term care facilities which deliver varying levels of care through different types of providers. Let's start by looking at skilled nursing facilities which provide specialized, rehabilitative care. For example, someone may go to a skilled nursing facility after a hospital stay for a recent fall. Skilled nursing facilities, however, are not residential care. Stays at these facilities depend on the length of someone's recovery. Residential facilities, on the other hand, include nursing homes and assisted living facilities. These facilities can be large corporate facilities with 50 to 200 or more rooms, or much smaller group homes in residential neighborhoods with only 5 or 6 bedrooms. In addition, there are hospice care facilities, memory care units, and others that provide even more types and levels of care. To better understand the type of care provided by a facility, it's also important to recognize who is employed there. There are a few general categories of long-term care employees, such as registered nurses, paid caregivers, also known as certified nursing assistants or CNAs, and other direct care workers such as physical therapists, occupational therapists, or dietitians. A next logical question is, how does someone pay for long-term care? If you, like many, believe that Medicare will pay for long-term care in a nursing home, you could be in for a big surprise. Medicare does not generally cover long-term care and will only pay for rehabilitative care in a skilled nursing facility or acute rehab facility for a limited amount of time. However, in order to qualify, specific requirements must be met. Throughout the country, the biggest insurer that covers long-term care is Medicaid. In Arizona, Medicaid is called Access or Arizona Healthcare Cost Containment System. Arizona is unique in that we have a special program underneath Access called Arizona Long-Term Care System, or ALTEX. If approved for it, ALTEX will help cover home and community-based services to help individuals stay in their own homes. However, in order to qualify, individuals must meet certain income qualifications and need to demonstrate that they need support with activities of daily living. Financially, many people find themselves stuck in the middle when it comes to this because they can't afford to pay for home and community-based services or residential care out of pocket, but have too many assets to qualify for Access and ALTEX. One solution for helping to cover the immense cost of long-term care is long-term care insurance. However, the premiums on these policies are incredibly expensive and only get more expensive the older someone is or can increase due to other factors. If the lack of available services or difficulty in getting coverage for long-term care services isn't challenging enough, many families will find or have found problems with the quality of facilities that they can afford. Many Arizona residential facilities do not provide the level of quality care that is recommended, such as sufficient staffing, training, or care standards. This doesn't even begin to describe the 24/7 struggle that unpaid family caregivers face, including social isolation, the physical strain of caring for someone else by themselves, or the financial difficulties that may arise because they need to take fewer hours or leave their jobs in order to care for someone. Limited access, limited affordable options, a lack of quality care, and the stress family caregivers are under make it extremely difficult to find a facility that will provide compassionate care. Simply stated, long-term care is complicated, expensive, and lacks meaningful choice. Arizona's current system is simply inadequate. but it doesn't need to be this way. That's why AARP Arizona is fighting to protect Arizona's most vulnerable residents and their loved ones by advocating to systematically transform Arizona's long-term care system through reforms such as increasing funding for home and community-based services, supporting family caregivers, making long-term care and long-term care insurance more available and affordable, and improving protections for residents of long-term care facilities. After a lifetime of hard work and contributing to society, older Arizonans deserve to live with independence, security, and dignity. High-quality, affordable care should be accessible for everyone. However, the system is not going to fix itself. It is critical that we take action to demand change. Join in the fight. Become an advocate at aarp.org/AZ.